Good afternoon. I'm Donna Cooper. I'm the Executive Director of Children First, and we are the region's child advocacy organization, really breathing life into a public agenda that will improve children's lives from when they first are born till they graduate high school and are ready to take on the world. So we work across the 5 counties. We're here today to talk about Delaware County. Every 2 years, we are the organization that puts out a report on the status of children. And we're unique in that regard. And we look at Bucks County, Montgomery County, Delaware County, Chester County, and Philadelphia County. And while there are many similarities for what children face across the region, every county has its unique experiences with respect to its children. Today, we are joined here for this report release on the outlook for children in the region post-pandemic, on the impact of the pandemic on Delaware County children, and a case for an ambitious rebound. This report is being released today, and we're very excited that Seda, who is a school counselor at the William Penn School District, Tanveer, Kaur, who's a president of the class at Upper Darby, and Dr. Monica Taylor, who is the chair of the county commissioners, will be with us. And here's Monica coming in the room now. So we do these reports every 2 years. The last report we put out came out in 2018. Actually, 2019, we released it just before the pandemic. Who knew the pandemic was going to strike? And I will remind us who are listening today that that report, first released in Delaware County, found that 40% of Delaware County's families were underwater, that their ability to raise their children on the resources that they were earning were making life very, very difficult. And they were making tough choices between giving their children the prescription drugs they need, paying their rent, and putting food on the table for 4 out of 10 families. Well, the situation is very different today in Montgomery County, in Delaware County, and it is almost more dire for some families and better for others. And that's the surprising news throughout the pandemic. So let me kick us off. One of the most surprising things that we found in COVID, and this is actually quite startling, is that the share of children in poverty in Delaware County dropped during the pandemic. So while thousands of families lost their jobs, while thousands of businesses were shuttered, good public policy not only protected children, but it lifted children out of poverty. There were, as of the end of 2021, 3,000 fewer children in poverty than compared to when the pandemic struck. That's remarkable. And in large measure, that is due to the fact that the child tax credit put significant funds in the hands of families, and they were able to have enough earnings between the child tax credit, what they might have been able to eke out during the pandemic, and other supports to stay above water. And there's a very strange thing happening. Here we go. So, in fact, if you look on the far right-hand side of this slide, you see 29,000 families received over $50 million in Delaware County as a result of the child tax credit. And I want to give a shout out to the William Penn School District, who I know did outreach to get families to take advantage of the child tax credit, and so did the county commissioners, because they knew how important it was that children were buoyed during this, and it worked. It worked. The other thing that we know is that children also were benefited by flexible federal policy that added 10,000 children to Medicaid. And by the way, 7,000 of those 10,000 are children of color. And they were able to get their healthcare needs met during the pandemic, in spite of the fact that their parents might have lost their health insurance. These children were able to continue to go to the doctor. And 7,000 children in the county benefited from SNAP, which we used to call food stamps. And they got school meals delivered at home. They got summer meals delivered to them by the extraordinary effort of the county and the school districts. And another 1,800 children were enrolled in SNAP. So kids really were very protected by federal policy. And that stands in contrast with the fact that 1,900 adults died. So 1,900 adults died, and those children are mourning the loss of grandparents. They're mourning the loss of aunts and uncles, parents in some cases, siblings, older siblings in some cases. So we have this extraordinary, death that swept through the county and our region and our state. And at the same time, wise public policy that really tried to curb the actual impact directly on children. So as I said, the big takeaway is good public policy works, and we'll talk a little bit more about that in a few minutes. The other thing we know in Delaware County is that they didn't have a health department when this started. The new county commissioners had passed the ordinance to create a new county health department, but it hadn't yet been stood up. And so they had to rapidly figure out, how are we going to create a screening and vaccination infrastructure without a public health department? And it just shows the vital role that a public health department can play. And Dr. Taylor and her colleagues quickly entered into agreements with Chester County, and Chester County really rapidly worked with the nascent infrastructure under Dr. Taylor's leadership in Delaware County to make sure that as much as possible, in spite of not having its own local health department, those critical pandemic-related health services were delivered. And what we know now is that this new health department, which has been stood up and I think is now, 3 or 4 months old in its operation, is got to begin to think about how it builds its infrastructure internally so that if another public health emergency were to take hold, it would be ready based on the lessons learned in the last pandemic. In addition to the pandemic being a whammy on the health of the county, we also had the dissolution of the Crozier health system. And the Crozier Health System was a critical player in mental health services for adults and children. And so now entirely new networks have to be built in the county. And I know that the county is very aware of this, as are the other healthcare providers in the region, trying to rebuild and restructure the infrastructure that children need to have their behavioral health needs met. And we also know during COVID, which was pretty remarkable, that the county and the district attorney and many education stakeholders worked on the Healthy Kids, Healthy Schools initiative to create a blueprint for increasing behavioral health services for children. So while the county was busy screening people, while the county was busy working with Chester to get testing out there, there were also a lot of efforts underway to deal with the collapse of Crozier and to begin to plan ahead. And they deserve credit given the weakness of the infrastructure that they had to start with. As I mentioned, in this county, 1,900 adults died. And one of the things that's pretty interesting is, while health disparities were talked about pretty regularly in the national media, Delaware County's deaths pretty much align with its share of the population by race. So what that means is that for the share of white families, which comprise 68% of the residents of Delaware County, 72% of the deaths were felt there. That's a difference, but not so great. We saw it much more pronounced in other parts of the country. And again, that's due to the amazing outreach of the institutions in Delaware County and the wisdom of the residents of Delaware County. But we did see some really troubling signs with children, and these are early warning signs that stick with us now. So we have something in the state called the Safe to Say helpline. It's a helpline for kids where they are to call if they feel bullied, where they are to call if they feel blue. And Seda, you probably know about this pretty well in your school district. Kids hear about the Safe to Say helpline in their schools. Well, during COVID, the number of calls from children who said they were considering ending their own lives or doing self-harm to themselves physically rose by 18% across the state. And in Delaware County, it rose by even more. So you see that the rate of calls from Delaware County that were about self-harm or the risk of suicide during COVID jumped by 43%. This is a small infrastructure, the Safe to Say helpline. Most kids don't even know about it. So the fact that children were calling this remote line that they saw a poster about in their school indicates that this problem was probably much bigger, that children faced extraordinary anxiety. And the national data is very clear that the large swaths of teenagers across the country are still dealing with this anxiety. Estimates are that 14,000 teenagers in Delaware County still are suffering from some remnants of the stress, the anxiety, and the depression and isolation that COVID imposed on their lives. The other thing that we know about Delaware County, which often goes in the opposite direction, is not that we spiked more than the state in student stress, but we spiked more than the state in terms of the county doing a good job and parents doing a great job getting their children immunized. County kids were immunized at 17% higher rate than the state. So we have a little bit more than half of the kids who should be immunized for COVID immunized. So good work on the part of the parents in Delaware County, but we also have nearly 43,000 kids that still need to be protected from COVID. And yesterday we did a press conference releasing this data in Montgomery County, and the student who spoke from Norristown herself had gotten COVID and she had been very sick. So this is still a very, very persistent virus and can still be dangerous clearly to people who have not been vaccinated. So these 43,000 children remain at risk. And as you can see here, the majority of children who are unvaccinated in Delaware County are white. The largest share by race of kids not vaccinated are Black, but they are the largest number of kids not vaccinated is white children, with 21,000 children who are white unvaccinated, 15,000 Black, 3,400 Asians, and 2,200 Hispanics. So there's work to be done in the county, and I know that the new county health department and school districts are hard at work on this. I will say that what we saw in nearly every county, but not Delaware County, is that more children are coming to school without their full childhood immunizations. And this is a warning. In Montgomery County, 2,600 children enrolled in school last year without their full immunizations: polio, measles, rubella, mumps, chickenpox, right? And so the anti-vax sentiment that sort of dampened America's willingness, many Americans' willingness to get their vaccination, is penetrating in families. And we think it's very critical that school districts and health departments be extraordinarily aggressive in reminding parents that vaccinating their children keeps every child safe. This is a really important message that we need to get out. So during COVID, we also saw a pretty dramatic effect on childcare in Delaware County. There are 2,200 fewer children in childcare today than there were pre-COVID. There are 52 fewer childcare programs, 10 of them high quality, 540 fewer childcare staff. And so that's the reason that there's fewer children in programs. There's fewer program providers, there's fewer staff, and as a result, thousands of kids are not getting this early start in life. And one of the reasons is because if you're working in childcare, you are now and have consistently be earning less than what you would earn in a big box store or even a Wawa, right? So you could go to Wawa and get paid more than you would get paid working in childcare. These retail jobs are paying 23% more than childcare workers. And Dr. Taylor will probably tell us her childcare story as we wrap this up. But the childcare supply has been really hard hit in Delaware County, and it may contribute to the fact that in Delaware County, the women, while your number of businesses have rebounded, the number of jobs have rebounded, the number of women in your workforce has not. They are still down from pre-COVID numbers. So we definitely have a challenge in the childcare workforce. Families typically need both parents in the workforce, 8 out of 10 in Delaware County, to stay afloat. And we know that there's lots of families that can't go to work because of the childcare shortage. We also know kids suffered during COVID. 38% of the kids in the county were not testing at grade level in 8th grade in reading or math before COVID. And then you have almost a year and a half of remote and interrupted in-person instruction. And Tanveer will talk with us about that, and Seda as well. But one of the things we need to understand is that in Delaware County, not every school has the same number of kids who will be struggling. The higher a school district's poverty level is, the more the kids were behind. So you look on the far right of this chart and you see William Penn School District. The green dot is the share of kids in poverty. The blue bar is the share of kids not performing well on their state assessments. And as you can see, there's a direct line. As your poverty rate goes up, your assessment scores go down. Not because the children aren't smart enough, but they are the same school districts that have the least amount to spend per child. So they have swollen class sizes, they have less instructional supports, and so kids who are coming from families that might have parents working too much to be able to help them with homework, or parents whose educational level might be too far behind to help them with homework, they're the places we need the most resources. And we have a gap of $150,000 per classroom between Radnor and Upper Darby, or between Radnor and William Penn. So we definitely know that the schools that have the greatest risk of children falling behind were the schools that were closed the longest. They were also the schools that had the least resources. So Upper Darby was closed longer than Lower Merion, right, for in-person instruction. And Lower Merion didn't miss, Radnor didn't miss a week. Radnor had laptops out in a week or two. William Penn, not so easy, because they didn't have the resources to purchase those. So those students lost learning. Now the PSSA results will be coming out soon, but the national data shows that children were further behind when they started school last year. And the likelihood that they caught up in 1 year is not so great, especially since last year also had open and closing because of COVID. So we have the educational spending gap and the disparity in what's available in school districts related to student need is definitely going to mean that we need to be much more intentional about how we make sure that kids catch up. We have 5 recommendations in this report, and the first one starts with the county and how it prepares for what we hope will be a public health emergency far away, but who God knows it could happen next year. And that is, we really think the county needs to create a structure that is an emergency response structure where there's somebody's job to think about kids and to think about equity as it relates to kids and what their needs are. And to create a manual now of lessons learned, especially working in tandem with the other counties, and making sure that we are ready to protect children better. Not that they weren't protected this time. County did really good, but we can always get better, and we must. The second thing is we've got to invest in students so they can get ahead. The state put $1.1 billion on the table for schools when it passed the budget in last June, the June that just happened. And that's a really great first step. And our districts in Delaware County received substantial federal assistance. And they are still using that money. That money's going to run out next year in 2020, at the end of 2024. And so it's not the case that all of our kids will automatically and magically be at grade level, both from their learning loss and where they were behind then. So we actually have to work with our districts and with the state to make sure we're doing everything we can to get our kids caught up. And even though the state put $1 billion on the table, Delaware County school districts are hundreds of millions of dollars underfunded, and it will take more than last year's budget to close that gap and give every kid an equal shot. Health services, and I know this is something where this county is actually thinking about it more than any in the region. And that is, how do we get behavioral health services into our schools? The Healthy Kids, Healthy Schools, Delaware County Healthy Kids, Healthy Schools Initiative is really a blueprint for how do we get a full spectrum of services. And I want to give a shout out to the county and the district attorney and the schools and the IU and external partners for collaborating to get mental health prevention, mental health first aid, light touch counseling, which is the critical gap here, and intensive therapy for kids in their schools. We also need to recognize that as we have a childcare shortage, childcare is getting more expensive. And as everybody knows, the US Senate has yet to pass a $380 billion bill to make childcare affordable for America's families. And that really has to happen. For Delaware County to fill the vacant jobs, and there's tens of thousands of vacant jobs right now in the county, to fill those jobs, childcare needs to be more affordable, and it is the best way to get people to work and help address inflation for these families. And then last, we need to make sure we don't have a spike in poverty. The US Senate needs to reinstate the child tax credit. Otherwise, the 3,000 child drop, 18% drop in child poverty we saw will likely be a spike in the wrong direction. Poverty has a permanent impact on brain development, and a permanent impact on stress in these families. It's very hard to get over. And so we can be ahead of the curve here for kids in Delaware County by making sure that the federal government does its part and continue these really good policies that make kids' lives better. So with that, I am so honored to have with us today Tanveer, and we think it's really important, since this report was about children, that we talk with Tanveer about the experience that you had and your fellow students had during COVID. Did what I described sound familiar? What did it look like for you or your friends in Upper Darby?
Hi, thank you so much for having me. But yeah, it all did sound a lot familiar. I mean, COVID created this cycle of, logging in virtually, logging out virtually, and it took away that social emotional aspect of school, whether that's socializing with your friends at lunch. And Upper Darby still doesn't have a cafeteria open. We get our lunches delivered to classrooms. But so many of my friends had struggles with mental health over the year and a half that we were, in our rooms doing school virtually. Personally, I joined our school's support and affinity group in order to cope with the new reality. And I know, talking with the teachers who run the group, that the membership for that group had skyrocketed because of COVID. And I know that's something that's unique to our school, but I know so many other schools in Delco don't have that. And I currently assistant teach at one of our elementary schools, and looking at their testing scores, they've gone up and down. And talking with their teachers, it's a pattern, because they've missed out on crucial learning blocks that build up, and that missing of that crucial education has really impacted them to the point where there's simple grammatical mistakes in certain sentences, and it's that element that they're missing, but it's so crucial for them to learn in order to thrive in a community. And I think a lot of struggle with it, especially in UD in general, because there are a lot of racial minority groups in our district. And personally, I'm a first generation, so mental health isn't something that's really talked about. And I know me taking part in that group was a first. When trying to get permission from my mom, she's like, "Why do you need to go there?" And I had to talk it through to her that I wasn't dealing with certain things correctly, and I needed to talk it out with someone who wasn't family and was a trusted adult, in my community at school, that I could lean on and get advice from. And so I really think funding for programs like that support and affinity group could go a long way in underserved districts like William Penn and Upper Darby.
Seda, that's so helpful. I mean, I'm sorry, not Seda, Tanveer, that's so helpful. And I want to ask you a question about the students that you teach, in addition to coming back on the mental health question. So do you think that those students can feel the fact that they're behind? Do they know that they're sort of missing out on your peers, and sort of, do you have sort of thoughts, in addition to your student teaching, what we should be doing about that?
Sure. Hi, everyone. Thank you for having me.
Oh, wait, Seda, one sec. I'm going to ask Tanveer to answer, then ask you the same question. Thank you. My apologies. I created that confusion.
I think they're aware of it, because we've had them do progress charts and flow charts with that, mark their progress over time. So I teach fourth grade at our elementary school, one of our elementary schools. So they see their third grade scores, they see their current fall fourth grade score. They know where to improve on. They know where they're achieving well, overachieving, or they're falling a little behind. And what we do is we try and have that one-on-one instruction, but because class sizes are so big, even at the elementary level, it makes it hard to have that one-on-one time. And I have a mentor, that's her classroom, but even with two adults or an adult and a teenager in a classroom, it makes it hard to get to every student and get everyone the help that they need.
That's so helpful to hear. I mean, it's not a good situation, but hearing the extra effort and that even that isn't sufficient because of the class size is really shows us what we're up against in terms of helping kids catch up. Thanks, Tanveer. Seda, you want to please jump in and talk to us about what you're seeing with your kids.
Yes, so throughout the pandemic, a lot of my work as a counselor shifted from working with students in person to supporting them online. And so even while we were kind of in the thick of the pandemic, a lot of students have expressed that they feel isolated. They feel like they just can't get a hang of the virtual platform or the curriculum. They feel like they're falling behind. And then that was causing a lot of anxiety, not only with just, keeping up with grades, but I've also found that I work in a middle school. So some of my, 13, 14-year-old students were also helping their younger siblings with their schoolwork. And so there was just this like a lot of, on top of school responsibility, there was home and life responsibility. And then the additional stress of if one of their family members or parents or guardian was sick. So there was also that anxiety piece of, is my parent going to be okay? What's going to happen? Now that we're maybe in our first semi-normal school year of students being back in the building, my students have expressed last year or the year before, they just felt like they're so behind now. They're just now starting to play catch up. And there's that anxiety of PSSAs, which was a big, concern too. Like, am I going to do well in this math piece? Because when we were doing math through virtual learning, it was just a lot. It was really hard for them to be able to catch up and kind of comprehend.
And so in terms of in William Penn, given that kids are feeling that way and they're also behind, what is your sense about the resources or the gap between what you have and what you need to help solve that?
So number one would definitely be more mental health or I should say support staff that can kind of check in with students on an individual basis. I think now, I'm just speaking for myself, I work with just the 8th graders, but that's around 355 students and just with me. So it's really hard to be able to give each student that time to check in with how they're doing, their mental health, their grades, to see what 7th grade or 6th grade those school years look like for them and kind of where they're struggling now. So definitely that push for more mental health professionals. And then also just the lack of resources for therapy outside of or in Delaware County, I should say. There are huge waiting lists just to be seen by a doctor. I actually had a parent reach out to me who's a close friend of mine. She's trying to get therapy for her child, and she's called at least 40, 50 different places. And they're like, we're sorry, we're booked. The next appointment they gave her wasn't until April of next year. And so it's just between the in-school kind of lack of mental health and also outside of school, those pieces I think would really, really help students kind of be able to adapt back into the school world.
That's so helpful, so helpful. So Dr. Taylor, it would be so great. You had your own experience in the childcare sector, but you also, as the chair of the county commissioners, probably have a pretty good perspective on what you all think is next for continuing to rebuild from COVID. So please share both of those if you don't mind.
Yes, well, thank you for having me, and thank you for putting together this report. It just really shows, where we are in Delaware County when we're thinking about our children and how they fared through the last few years since the last report. In terms of kind of the topics, just thinking about first the daycare situation. And as you know, we've been on so many calls over the last 2 years about this and how COVID has taken a toll on our families and also the ecosystem of our daycare structure. You know, for my personal story, right, I have a almost 2-year-old. And last year we were on a waiting list for quite a while, and she got in. We were going to start in September. She started daycare in September, and they had to close down the baby room and the young toddler room because they did not have enough staff. And they were not able, our daycare center was not able to reopen that room. She did not get back into daycare until the end of May of this year. And during that time, we went on several different waiting lists and were not able to get into any other daycare center. And some of those, I'm just starting to get callbacks now that are saying, oh, we have space for you in October. So that's almost a year waiting time. I was lucky enough to have friends and family, my mother, my husband's mother, like my mother-in-law, all of these people helped to kind of piece together our childcare for our baby while we were both working. But everyone else is not in that situation. And we just had a recent study on just in general, our economic development. And one of the items that came back from that study actually said that it looks at the women in the workforce in Delaware County won't be at full recovery until 2025. And a lot of that is due to childcare and getting back on their feet from this lack of childcare and lack of being able to get in and having that stable care system in place. And so that's just kind of to talk to a little bit about that childcare piece. One of the lucky parts, I know we all worked with so many different partners across the state to try and make this more of an issue on the forefront. And one of the successes there is that it has been added to the list of priority jobs. And so we in workforce development are looking at how we can help to develop more programs and put funding towards that and get folks trained so that we can have more workers coming up through the pipeline.
That's terrific. Yeah, keep going. Yeah.
And in terms of mental health and mental health in our students, there are two pieces there. You mentioned it a few times. The Healthy Kids, Healthy Schools program, we really do have high hopes for this program. You know, we went through this whole phase of working with our schools, our IU, our district attorney, stakeholders in the community to really do a deep dive at how our system works now and where it's not efficient, where folks do not have access, where people, the general population, they don't even know necessarily where to go or how to get help. And there's so many different layers that they have to go through in order to get the help that they need. And so that we are really hoping that that program is going to help the system be more efficient, more family friendly, more people friendly, and trying to really cut down on all of the excess and get folks to what they really need, and also helping our school districts and getting into our school districts so they have a direct line, and it helps with the efficiencies for them too. And so that's the hope of the Healthy Kids and Healthy Schools program. And in terms of the lines and just not the lines, but but the weight that folks are experiencing, you know, we have all counties have been hit by this, just not enough providers in terms of mental health. And those providers and the ones that we have, it's really hard for them to also increase because they don't have enough people, and they're also not being funded well enough in terms of reimbursement, in terms of state dollars, all sorts of pieces of the puzzle. We have been actively trying to recruit more providers into our Delaware County space, and whether that's going to other Southeast Pennsylvania providers that aren't necessarily working in Delaware County and trying to help them by providing startup dollars for them to come and have a footprint in Delaware County and provide services to Delaware County, reaching out to Jersey, providers in New Jersey, seeing who is able and willing to come in and really trying to cast a broad net, and also thinking about ways how we can help to build up that pipeline of individuals who are going into these fields. I was just talking to Elwin the other week about, you know, how can we think about it in terms, and I was also talking to, it came up in a meeting I had with our superintendents, just trying to figure out a way to build that pipeline so that we have more people going into this industry so that we can provide more services. Because if we don't have the providers and we don't have the specialists, we can expand and we can't meet the demand. And there is such a great demand out there for mental health services. And our goal is really to try and meet it as much as we possibly can and think outside the box, because what was working before is not working now. We have so many people in crisis and so many people who need the mental health support. Trying to figure out how we do that and how we get the help to our residents that they need is really our top priority.
Well, it sounds like from what I'm hearing, the lessons of the pandemic have seeped into the conversations pretty intensively at the county council. It's very clear that Seda is on the front lines trying to figure out with her 350 eighth graders how she mitigates that given the shortages. And Tanveer's working in an elementary school. I mean, all three of you really deserve a big shout out for really trying to do what we can to rebound. But like at the end of the day, I'm waiting for a year on a child list for waiting for a year to get your child into childcare, where their little brains are going to be developed and you can go to work, waiting for a year for mental health support, having class sizes that are too big to ensure that kids catch up, and the risk that more children will be in poverty. They are the takeaways of what is happening still, not just in Delaware County, but across our region in terms of what we talk about wanting to make sure that all of our kids are doing better after COVID, and we have a lot more to do together. And much of that revolves around how the federal government, how the state government steps up, and how the local school districts and the counties really use the resources that are put on the table. We are going to be holding a community event in Delaware County to talk about all of that more broadly this fall, but we wanted to release this report as soon as possible because the data is the data. We want to get it out there. We want to begin the conversation. I'm going to ask Linda, who's on as a reporter, if she has any questions. Linda, do you have any questions for anybody who spoke today?
Well, I was wondering, is there a link that people can go to if they need services, like a county link or something?
So, Monica, I don't know if you guys have a centralized vehicle for people to call for mental health services.
Yes, you can go to our delcopa.gov website and go to Department of Human Services. In there, you'll be able to find the information in order to reach out to Human Services for any services or support currently. Our goal is to actually have, especially when we're talking about our school age children, is to have a centralized system for both the public and residents to be able to reach out to a direct no wrong door policy. So a direct number that'll filter to that our healthy kids, healthy schools, and also for our schools to reach out directly.
And I will say that, Linda, that one of the things that happens is that behavioral health services are paid for through private insurance and public insurance. The county is not the main payer. And so often parents are having to navigate what does their health insurance system permit them to get. And that's one of the things that the Healthy Schools, Healthy Kids Initiative is really about, which is about how do we make it so that regardless of who's paying for services, kids can get the services they need. And this is really what sets Delaware County apart. It's having this conversation about how to organize this work in a way that there's no wrong door. And so the county Department of Human Services, the school district IU, the intermediate unit, and the school districts are places people can call for help. But as you heard here, mental health system is in crisis in terms of staffing and short supply. So I wouldn't want people to just think they can call this number and then their kid's going to get all this help they need, because that's one of the points of this report. There is a shortage of resources to meet the needs of children.
Okay. And demographically, how many children are living in Delaware County?
And 123,594 children under 18.
Okay. And then one more question for Seda. What is your average class size there in William Penn, if you know?
Sure. So we are anywhere usually from 25 to roughly 30 students. 30 is our maximum. So we're kind of around that number range, anywhere from 25 to about 30 per classroom.
Okay, thank you.
Sure.
And contextually, again, let me just say that, I don't know, Linda, if your background's in education or not, but, you know, education research really indicates that for students who are behind, being in classes that are between 17 to 20 students is the ideal learning environment where a teacher and a teacher aide can ensure that the students have enough attention to catch up. So they're at half the size. I mean, they're at double the size they ought to be to ensure that kids in William Penn or Upper Darby really get a decent shot at learning what they need to learn to get ahead.
Okay, I think that's it. Thank you.
Right.
All right, well, I want to thank Seda, Tanveer had to jump, and Dr. Taylor for being here, and Linda for you being here, and we'll be sending all the materials out. Thank you very much for listening to the Children First report today. Thank you. Bye-bye.